Hey everyone, welcome back to another episode of the Brawn Body Health and Fitness Podcast. I'm thankful that you're tuning in today. Today I'm joined by Danny Foley, and Dan and I are going to be discussing fascia training. So, what is fascia? What does it do in the body? And how can you train it? And what is the impact on human performance and health and longevity physically? So, this is an amazing episode. I wish I could have talked with Danny all night about this because we really hit some awesome points, and I know you're going to love it. So, make sure you check out everything on Danny's website and his social media page they're linked below. Enjoy. Dan, welcome to the podcast. I'm super excited to have you on today, man.
No, man, I appreciate you for having me. I'm really looking forward to this talk, especially after we just wrapped up that preliminary discussion there.
Yeah, for sure. For people who might not be familiar with you and all the amazing stuff that you do in the realm of human performance training and that sort of thing, would you mind filling them in a little bit about who you are and what you do?
Absolutely, man. Yeah, so I just recently relocated to the Dallas-Fort Worth area down in Texas after spending about 6, 7 years in Virginia at Virginia High Performance. My wife and I, Nicole, just kind of felt it was time for us to take on a new set of challenges, change our scenery up a little bit. I had also been in Virginia for my entire 32 years of life, so for me it was kind of just looking to switch things up from a personal lifestyle as well. But yeah, man, since we've gotten down here, it's been really fun. I've had a lot of different things to adjust to. The traffic patterns of DFW are very, very high on that list. Um, but I've come into a place called Bachik Methods, which is in Addison, Dallas, Texas. And it's a really, really wild place, man. Ryan and Kendall Basic are the owners. It's a private sector facility, and it was funny, man, because when I went out there for our meeting, Ryan was the first person to hit me up when I was moving down here, and they work predominantly with severe spinal cord injuries, paralysis, quadriplegics, severe TBI head injuries, a lot of metabolic disorders as well. It's truly, the most difficult type of work that any of us can do. And there's just a very unique sense and feel and energy to the people that are in that building and kind of the things that they're doing. And it fit very well with my approach to things. So we pretty quickly kind of put some plans together, linked up in a partnership. And now I'm actually literally right in the process of launching our initial program, which is going to be the Athlete Restoration Project. And this is going to be dedicated for predominantly retired professional athletes, but also to include, people just kind of, struggling with chronic pain and complex injuries. And, so for some instances, people who maybe didn't have a lot of success in the conventional rehab setting, we want to take those things on. And I think that, the combination of what I'm bringing after my 7 years of working predominantly with the Navy SEAL population, a lot of injuries and a lot of complexities to that world, and with what they're doing with the severe TBI, concussion, and spinal cord injuries, is bringing together a very unique product.
Yeah, I would say so. That is certainly very unique. And, you just mentioned that you worked with very high level individuals there in the Navy SEAL population, and they are some of the most active, physically demanding types of roles that you can think of. But as a result, they also take a lot of abuse. So I'd imagine that your training for, a population like that has to be effective because that training can literally mean the difference of life or death for some of them, but it also has to be friendly enough to them that they feel good afterwards. Because if they train so hard that they feel awful afterwards, then they're not going to be able to do their job. Not imagine the same is true for athletes that you work with or different patients in the neurologic population as well. Is you need to find a way to challenge them but not push them so far to the point where they can't do basic things that they have to do day in and day out.
Yeah, I mean, that was very well said. We had a tremendous opportunity at VHP, and I had a tremendous opportunity there. I loved every second of my time there. Um, but we had the unique opportunity to work with these men and women in the private sector. So there wasn't a lot of constraint from oversight, which is invariably a problem in that world. Um, we had the opportunity to kind of be creative and do things in a different way. So this will kind of tie two ends together here was actually really my impetus for all of the fascial based methodology and approaches to come, thereafter. And, I always try to make it a very clear point that, like, I didn't just reach and grab this fascia stuff and just start, kind of making things up for the sake of it. No, I very much tried to apply what we were taught, what we were told to do, what's optimal. I read all the literature and all those, common books across all of S&C, and it didn't work. So it was, we were, like you said, we were forced to kind of find a solution in that moment, and it just led to this. And it was a lot of unilateral training. It was a lot of dynamic efforts. It was a lot of cross body rotational patterns. It was a lot of, kind of intersecting, certain cardinal planes and kind of trying to find new ranges of motion, paths of motion. So at the end of the day, you can call it and term it whatever you want. But as I started to study more down that lane, particularly with the injury restoration and management, it just kept leading me back to fascia, fascia, fascia. So then I started to study that in an isolated manner.
Yeah, that makes a lot of sense. And, I think we talked before about how it doesn't seem like anyone really understands fascia. A lot of people look at it and they say, oh, well, it's a connective tissue. You got it in different places. Like, it's in your back. It connects like your lat to your spine or your glute to this or something like that. But for people who might not have heard the term fascia before, or maybe don't understand, what it is, what it does, and how it really functions in the body, would you mind kind of filling them in a little bit about fascia and what all you do from a training standpoint for it?
For sure. So we'll start with like kind of a nice little layman's, description with a bow on top, and then we'll dive more into some of the detailed and nuanced aspects of it. But at the most basic level, your fascial tissue is a single interwoven and global connective tissue that spans throughout the body. It's predominantly made up of collagen, water, elastin fibers, and then a couple other things. But it has an ability to distend in a way that that muscle in general and other connective tissue don't necessarily have the ability to do. So it's very important for structure, posture, general locomotion, movement. And when we go a step further on that, the fascial tissue is not uniform throughout. So although it is, loosely, completely interconnected, there is a different elasticity and density to fascial tissue depending on where it's located. So for instance, you have your plantar fascia arch, or your medial longitudinal arch, and then you have fascia that essentially kind of covers the abdominal walls, and really protects also the organs underlying. So the density and the mechanical aptitude of the fascia at the arch is going to be much different than that kind of overcoat or layering within the abdominal wall. So it's a very versatile structure. It's a very versatile tissue. We also then have the sensory motor and the proprioceptive aspects of fascia, which I think even more recently, kind of since, within 2018, 2020, we're really starting to see a lot of research being generated about the proprioceptive acuity and the sensory motor functions of fascia. So to kind of recap, summarize that, it's a global connective tissue, head to toe, interconnected, but variable, versatile throughout. It has some level of contribution or significance for postural purposes, general movement, locomotion, structure, and then is also largely involved in the sensory motory function, and also the proprioceptive function, as it's embedded with all of these free nerve endings and receptors.
Gotcha. So, as a result, since it's got so much importance with sensory motor and proprioceptive, things like balance and I would say overall bodily stability are going to be very closely linked to your fascia systems as a result.
100%. And there's a term that's called interoception. And interoception is a fascinating thing to just generally dive into, get lost in a rabbit hole in. But interoception is essentially our body's perception of how we feel or how we are currently functioning, performing, or what have you. So this is largely a factor in kinesthesia or kinesthetic applications of training. So not only just limited to static structural balance, but also your ability to kind of connect and sequence movements together and move in different directions seamlessly. So your body's ability to detect itself in space and sense where your center of pressure is, where your center of mass is, etc., is going to be very, very predominant for the expression of movement that will follow.
Gotcha. So it's not just important in static senses, but it's also essential in a dynamic sense to understand how to and understand the role of like fascial anatomy and function, I'll say. Would you say that the fascia function in dynamic nature tends to be more of like something that you would think of in like, I just want to use the term like a springy athlete, like someone who's really quick? Or would you say it's more of like a stiffness thing, like something more rigid? Or how does the fascia properties itself, I would say, impact athleticism or movement in general?
Yeah, so this is actually something that I'm continuing to kind of shape my perspective on and really understand completely for myself, to be perfectly honest. Um I think that the easiest examples to point to are what you alluded to first, and that's the typical connotation is that, fascial based movers are going to be more springy and bouncy and, have more elasticity in their motion, whereas muscle movers are going to be more kind of bulky and heavy, but they'll be tougher to move or change course. I think that there's a partial truth to that. The limitation that I used to believe that conclusively. But the thing that is kind of getting me to take a step back on that is that the fascial tissue isn't necessarily producing movement. There isn't much of a contractile element to fascia, if at all. Where it becomes, kind of a big player is in the think about a slingshot being drawn back. So that elastic recoiling that occurs during counter movement, I would say that that is something that has more fascial significance, than the other phases or the other pieces. But with that, I still find myself thinking that the primary thing that is different about fascial based movers versus non is their ability to sequence movement. So it's not just enough to be powerful or explosive, but it's the ability to connect stride to stride. It's the ability to connect the left side of the body pulling backwards as the right hand is coming forward for a cross or a jab, right? It's like you have to be able to put all that in action, in a very rapid sense, which we understand agonist antagonist coupling, but I think that there's another layer to that too. And then with that, being able to do so with different counter levers and with different moment arms. So with different foot positions, different center of pressures, segments work differently. So if that, you know what I'm saying? So
Yeah,
I
I
think
do.
that's really what it boils down to. But again, I'll say that the versatility piece applies as well. Creating stiffness in the midfoot, we need to have more of that anti-movement or that stability factor of the arches and the fascia of the feet being able to stabilize and extend and hold in an isometric fashion, just as we need to have our springiness in the windlass mechanism during, a sprint cycle.
Right, in the foot, and even just going back to my classic example of the posterior oblique sling system between the glute and the lat, interconnected by the thoracolumbar fascia. I would imagine that essentially through that connection, you're basically just winding the fascia, and then it's a quick release, and that release gives you your energy and power, from what I'm understanding. So
100%.
if I'm looking at how someone moves, right? You mentioned that some people are, I think you used the term fascial movers. So I'd imagine those type of individuals would be people who can really, disassociate the hip rotation and the shoulder rotation to
Right.
cause more fascial winding, and then release all that stored energy all in one quick moment. Kind of going into like physics terms, essentially I look at it as like they're able to create a higher amount of potential energy and convert it into kinetic energy quicker, which for sport implications would be effective for, I would imagine, sprinting, power production, any kind of rotation, that sort of thing.
Well, and I just thought of this as you were going through that, but you know, another part of the reason why I step down from like if they're bouncy and twitchy, their fascia, if they're not, their muscle, is trapeze artists, right? Like trapeze artists are probably one of the, if not the best demonstration of fascial driven movement, right? Being able to bend and contort in all those different positions just requires a different, you know, optimal anatomy, so to speak. But in addition to that, though, I think the other thing that people get really jammed up in is the terminologies to things. So like one thing that I will get, you know, some crap on, and I actually don't get nearly as much as I expect I would, but one thing I do get some pushback on is when I use the specific terminologies or the slings or the meridians or the lines or whichever one you pick. And then finally one time somebody was like, yeah, you know, that's cool, except your posterior oblique sling isn't a real thing. And so I responded back, well, do you use the term posterior chain? I mean, they're one and the same, right? Like it's a description of our anatomy, because if we want to be super technical about it, every muscle, joint, and anything else in the body was just named by somebody at some point. So for my sake, I think that it's important to define this, that, you know, really it's more of a difference in perspective than it is in principle. I still do most of the same things that a conventional, you know, S&C coach would apply. I just view it in a little bit of a different way and therefore tweak my exercises in a different way.
Fill me in a little bit on how you start to tweak your exercises, how you start to modify your sessions or movements, and how you might even just structure a session where your goal is changing different properties of fascia or training someone's ability to utilize a fascial based movement system, we'll call it, more effectively.
Yeah, so for sure. So everything is formed through the assessment and in the intake process, and you know, the structural side of this is much easier to describe. So we'll start with that. So I have 4 basic fascial line assessments that reflect the anterior functional line, the posterior functional line, the lateral line, and then the spiral line. So essentially, it's these combination of lunges. We have an anterior coil lunge to a reverse lunge with an overhead reach. We have a lateral lunge into a curtsy lunge with an overhead reach. And then we have a single leg crossover RDL to a side bend. And then the last one is basically a split stance rotation with an overhead reach. So the reason why I have the PVC pipe as a priority here is because 3 of those 4 lines actually originate at the posterior aspect of the humerus, right, or the back of the arm. So with that, if we want to engage that full length of the fascial line spanning from the back of the humerus to the heel, we need to have our arms active. So that's the purpose there. And then from there, we're just looking at multiplanar movement, right? Omnidirectional motion, loading into different ranges of motion through different vectors, and the ability to sequence or combine movements, right? So going from forwards to backwards, left to right, over to this side. So in my mind, it gives me all of the same criteria and opportunity that I would get in any other organized movement assessment or protocol. And in this case, it gives me a specific opportunity to see the body the way I see it. So the coiling aspect in that first one that I mentioned is something that's going to be reflective in programming over and over and over again. When I teach a kettlebell split squat, I don't teach the athlete to just drop or descend in a purely vertical fashion. I want a little bit of trunk rotation, speaking to what you were mentioning about the lat and the glute. So for that reason, I should probably have it as a part of my assessment or intake process. So it's those kinds of things where I'm not doing a totally different thing. I'm not having people juggle and balance with their eyes closed. We're doing basic structural movements. They're just defined in the way that I see the body. So for the training side, most of my training is going to be done barefoot. I just think that, you know, again, similar to how the PVC pipe engages the superior aspects of the fascial lines, not having shoes on helps to stimulate and engage the more inferior, the lower parts of the fascial lines. I also think that there's a lot of benefits there just for the lower leg and the ankle. But to stay on track here, barefoot, very minimally will we be in a bilateral stance. We're going to do almost everything from either a kickstand or a B stance, a split stance, or a single leg. And we are, again, going to prioritize planes and paths of motion and doing things with different resistance types, loading it from different vectors. I'm going to utilize all of those things before I just say, hey, we're doing a barbell single leg RDL and we're going to add 5 pounds every week for the next 6 weeks. I don't work with any developmental athletes. I don't have anybody from like 12 to 20. So for me, that stuff doesn't have a lot of purpose. When we're trying to optimize the ability to move and the ability to detect how the body moves in space, for me, those things don't have enough value. So I do things more like a contrast single leg crossover KV RDL. So rather than just having the straight barbell, we're using a kettlebell. Rather than working straight down, straight up, we're going to cross over the body to the pinky toe. And then rather than just doing every rep with weight, we will sequence that with weight, without weight, with weight, without weight. So those are probably some good examples for you.
Yeah, I like that a lot. And you mentioning at the end there about how you'll do a rep with weight, without weight, like to me, that's a perfect way to help someone explore a force velocity curve, right? Like if you put someone in that position, you're kind of describing their single leg crossover RDL, and you do, your first rep with a heavy kettlebell, and then you leave the kettlebell on the floor and you do it again explosively and then pick it back up. You just
sure.
hit high force or higher force at a slower velocity, and you can control that, while then the next rep hitting lower force at a significantly higher velocity. Like you can literally work in a force velocity based approach to a more fascial based training system. And I also love that example a lot, because going back to what we mentioned earlier about posterior chain, posterior oblique sling, whatever you want to call it, between the lat and the glute, like if you think about it, that little crossing over kind of motion that you're doing as you're coming down, that rotation actually matches from the lat to glute connection, winding the fascia, as we mentioned earlier. And I would imagine, I mean, I've used that with a few athletes in physical therapy before, and every time they tell me that, like, their butt is on fire with like a 30-pound kettlebell, and
Yep.
it's like, minimal to no load is giving significantly more result, or at least the athlete feels like they're getting more result from that kind of training style.
So I think a couple of underlying things there too. Number one, it forces them to be more conscientious during their actions or during their lift. By giving some of these subtle details, this contrast application is just a good example of that. But in addition to that, I cue that, whether it's the crossover RDL or I'll do that for rear foot split squats, I'll do that for rows. I've applied that in a couple of different ways. But that with weight, without weight, with weight, without weight, I cue that specifically, that there should be no change in action, and sometimes speed as well, between having or not having the weight. So what that's giving me a look at is their reliance for either intrinsic or extrinsic stability. And you'd really be surprised with this. Totally anecdotal, but the stronger that somebody is in a conventional sense, so a guy or girl that can, RDL or deadlift 400 to 500 pounds, will struggle mightily with the reps without the weight, right? And for this, it makes me think about how non-contact soft tissue injuries occur, right? It's very rarely, if ever, because there was a force overload. It's because the force was applied faster than the athlete could respond to it. We've seen thousands of cases of people that can back squat 600 pounds, and then on Sunday they go out, change of direction is unanticipated, boom, their knee goes. I mean, that's body weight, right? So it's not a force problem. It is a timing problem. And then from there, a sensory motor or proprioceptive problem. So those are the types of things that really generate my overarching principles and philosophies for programming. So they just become reflective in those things.
Right. And, just thinking about a traditional strength and conditioning model, I mean, think of like what I would call like a stereotypical leg day, right? Someone, maybe 20, 25-year-old goes into the gym, maybe they're an athlete, and they're probably hitting back squat, leg press, leg extension, leg curl, and a calf raise. Like that's just stereotypical leg day. Nowhere in there is there any kind of incorporation of rotation. Nowhere in there is there any kind of incorporation of these different positions that you mentioned. And nowhere in there is there any single leg work. And, most of life, especially athletically, occurs on one leg, right? Every time you're running, you're basically jumping off the ground and landing on one leg over and over and over again. So I love everything that you've explained on your approach here. Now, we've talked about a little bit about how fascia will help us from a force production standpoint, not because it's a contractile tissue, but because of its interconnection and the ability to wind. How about the role of fascia in the opposite, in deceleration or reducing force? If I'm an athlete and I want to slow down and change direction quick, where would fascial training or fascial subsystems come into that?
Yeah, what a great question. Um, so I would I would probably argue that it's more important or significant in deceleration or eccentric mechanics than in concentric or production. And the reason for that is the dispersion of force. So I'll use the foot and the lower leg for this because it's definitely the best example. So when you start to understand the anatomy of the foot and you start to prioritize it in your assessments and in your intakes, you should quickly realize how significant the feet are for anything training related, any training purposes. And you'll from there also notice that most people have very poorly functioning feet, from lacking intrinsic strength to lacking compliance to reduced mediolateral control and being able to articulate their center of pressure through different aspects of the foot. It's a very sophisticated structure, but the main priority for the foot in terms of deceleration, change of direction, etc., is the ability to eccentrically load, be compliant to the ground or to the environment, and channel force to be distributed up the chain. So I think about it like this. If we have the big toe and then the four toes, we essentially have, 4 or 5 channels for force. So we're sprinting, foot hits the ground, that ground reaction force is then channeled through the foot. If we have all 4 or 5 channels optimally functioning, then it's distributed. We'll just stick with the round number of 5, distributed 5 ways. So 20% across each part of the foot. That is going to give a better distribution of force coming up the calf and through the tibia and to the knee. Let's say now we've lost 3 of those 5 channels, leaving us with 2. We have somebody who excessively pronates, has midfoot drop, and basically kind of lives in that foot eversion state where their pinky toe doesn't really touch the ground. Very common thing. So now we're working with a 40% capacity of what we optimally should. Or in other words, now 2 segments of the initial 5 segments of the foot are taking on 100% of that force. And as we know, there's no forces that are greater throughout the body than the ground reaction forces at top end speed, right? So a tremendous amount of force being put through 2 segments of the foot, then having to go through the ankle. To stay on track here, that is the precipice for shin splints, chronic ankle sprains, chronic knee problems, whether it's patellar tendonitis or if it's something more significant, a ligament, chronic ligament sprains or damage, arthritis. All of these different things are due to the imbalance or the mismanagement of forces, right? I call them the itises. Those are very simply consequences of disproportionate stress management or distribution. So the role that fascia plays in this is quite complex, but to keep it basic here, it starts with that windlass mechanism, which is the full tensioning or locking of that medial arch. So for this to happen, we have to have flexion in the big toe. We have to have the heel suspended off of the ground, and in most cases have some presence of dorsiflexion. So that full locking of the arch gives us the optimal, transmission of force from big toe to heel to then Achilles and up. The fascial integrity there is the stability concept, right? So for there, it's that ability to stabilize and hold. Then we have kind of our spiraling action around the lower leg. And in my mind, this is how the force is kind of rotationally sent throughout the body. So it's not just the linear, mechanics of this, but also the ability to accommodate for the rotations that are occurring. And if we have either, overly compressed or overly stretched any of that lower leg fascia, You know, on the lateral aspect on the peroneals, or more that posterior tib side on the medial aspect of the ankle. With those things, we want to have good symmetry and balance, because if we are, you know, kind of pulled into, again, like just saying that external tibial rotation pattern, then we're going to be overly compressing and overly utilizing those medial aspects. And that over time will provoke something, right? It's not going to guarantee an ACL or an Achilles, but something is going to happen if those things aren't accommodated.
No, I completely agree with you. And I love how you broke it down from the sense of forces, because ultimately that's what we need to look at, is force absorption and where the force is being distributed. And I've never thought about it like you explained, of how, you know, say 2 or 3 toes aren't in contact with the ground, then all of the other forces that we absorb from the foot are going through the other toes. I love that you brought that up. And that also explains, in a fascia sense, one of the things that I'll do very commonly with athletes. There was an individual who just came in about a month ago who was telling me about his ankle. I was kind of looking at him, and he had a hard time getting into what we call a subtalar neutral position, and he couldn't maintain it. So I am by no means an expert when it comes to tape. My tape jobs are atrocious, but they get the job done. They just don't look aesthetically appealing. But I took some Leuko tape, which is kind of like physical therapy duct tape if you've never used it. And I just kind of put him in a subtalar neutral position and just kind of
Yeah.
locked him in there. And before versus after, he increased his vertical jump by 2 inches just by doing one small thing that took like 3 minutes, by changing the way his foot absorbed forces and produced forces. So this is one of those things that it's like, you know, not only is it effective from all the itises that you mentioned before that, you know, we see as pain and pathology, but it's also really effective from a performance standpoint, because if you can get this right, it can make a world of difference in a matter of minutes in some cases.
No doubt, man. And I love the intuition in those things. Um, you know, the other thing that I didn't mention, but it's very important here, is also the concept of they're called myofascial force expansions, and this is something that's specifically a derivative of the Stecos, who were, you know, kind of pioneers in the fascial world. But myofascial force expansions are essentially a broadening of tendons. So it goes right back to that same channeling concept, right? Where with the Achilles tendon, if we have a very narrow and linearly dominant Achilles tendon, that gives us only that bandwidth for that predominant force transfer. These myofascial force expansions are, you know, taking the tendon from being very narrow to kind of angling out a little bit. So having more surface area to distribute force means that we are more efficient in that process. So very simply, collagen fibers are laid down in the direction and in the places that they are broken down, right? In the area that there is the most damage, we will, you know, calcify and then create more collagen in that area in that direction. So with that, that is the reasoning for a lot of this angulation, different patterning, different foot positioning, because we have to stress the body in those positions, and the foot positions are quite bountiful. But you know, to that end, we want to try to build a robust system that can accommodate for a lot of different directions, because you were talking earlier about how, you know, almost all of sport is played on one leg. Well, not only that, but it's all played on one leg with time constraints and with unpredictability, right? So there's never I hate when people say like, oh yeah, well, football is a sagittally dominant sport. Like, no, it isn't, man. Like, it's nothing dominant. It's everything dominant. There's so much detail to it. So those little things go a long way in my mind.
Yeah, I completely agree. And, you know, as you just mentioned, sports and athletics are unpredictable. And one of my favorite things lately has been to watch multi-sport athletes kind of innovate and change the game in the realm of a sport, right? Like, I think back to a guy like Patrick Mahomes when he first came into the NFL there, like the stuff that he was doing, like, you know, he would run up to the line of scrimmage and just kind of alley-oop it over, and it looked more like a basketball move than a football move, but he's playing football. Like,
Right.
there's so many pioneers and innovators in the world of athletics that you really can't restrict a certain sport to a certain plane of motion or certain movements, because there's infinite, and people are always finding new ways to move and new tricks and new cuts and that sort of thing.
Well, and since you mentioned his name, I can't think about Pat or watch Pat play without giving a tremendous amount of credit to Bobby Stroop and the APEC team for what they've done with Pat. You know, people kind of forget that Pat has trained there since he was a kid. You know, that's kind of
Mhm.
been his thing for a while. And if you look at their training, if you look at what Bobby does, it's a lot of the same concepts. Bobby and I are very similar in perspective and approach. And I mentioned I actually tweeted something about this when he went down in that playoff game with that lateral ankle. And to me, that's a play right there where 99 out of 100 quarterbacks are down for 6 to 8 weeks. But the way that Bobby emphasizes foot position and center of pressure and change of direction and lacking predictability, there's not a doubt in my mind that he was, able to kind of prevent himself from having a more severe injury because of the robust training that had preceded it.
Yeah. Yeah, no, you're absolutely right, and the fact that he started at a young age too, right? If you look at a guy in their mid to late 20s and they start training in their, 8, 9, 10, 11-year-old range, well, plain and simple, that's, 15 years, if not more,
Yeah,
of repetitive training through these motions of these systems. Like,
yeah,
that's going to have a profound impact long term as opposed to someone who just started a week ago.
no
So,
doubt. No doubt. And genetics are always at play whenever we pull these names. I know that's the easiest way for people to counter it is, yeah, well, you still, yeah, I get that. But, you know, if we continue to undermine what we do, then I don't understand how anybody in our field could ever ask for or demand a pay raise. I mean, it's like we deprioritize ourselves with these things. But I think Pat and Bobby are just a really good and obviously a very public and kind of limelight type of example of all of these things that we're discussing and how it does absolutely matter and how once we break away from we have to just get people to squat 500 pounds and run a 4.40. I think we'll understand that there's so much more value in training through variation and versatility rather than just being these zealots to progressive overload and redundancy, man. I don't agree with that anymore. I really don't.
no, I completely agree. I mean, at the end of the day, we're building athletes or we're building
Yeah,
movers. We're not building weightlifters, at
right.
least not in the realm of athletics and human movement and human performance. Yeah,
Yeah,
sure. If your goal is to be the strongest guy on the powerlifting platform,
right.
overload, but
100%.
don't expect to go out and dominate the lacrosse pitch
Right.
as a powerlifter.
And if you look at all these sports, man, like and I've spent a pretty good amount of time watching the film on all these things, but every primary foundational motion in any sport has that reciprocation of the trunk, the disassociation of the pelvis and the ribs, various foot patternings, never bilateral, So again, like in my mind, I'm like, man, I think we're just really overthinking a lot of these things. And we're doing exactly that. We're trying to create the top power lifter, the top weightlifter. We just have to be, a little bit more giving on what are the demands of sport and how can I emphasize that, not recreate it, emphasize it within a training setting.
Yeah, no, I completely agree. Dan, I feel like you and I could probably talk about this all night long, but as we start to wrap up here, do you have any kind of closing thoughts or closing remarks or anything you want people listening to really take away?
Well, no, I mean to kind of keep it in line with with the meat and potatoes of this conversation, man. I think, if there's any young strength coaches, practitioners, listening to this, the best unsolicited advice that I can give is just very much keep an open perspective and an open mind for the first 4 or 5 years of your career. Really saturate yourself in the learning phase and in the generalizing phase before you try to develop this specialty or this niche. Sample and experiment with a lot of different things. Try them for yourself, try them with different athletes and populations, take, very detailed notes on it and then really just kind of allow the principles, methodologies, and the systems, so to speak, to start to develop themselves. You know, I started out with all of this with a very clear-cut intention of I'm going to be an NFL strength and conditioning coach one day. And then, you know, within the last 3 or 4 years have gotten to a point where I realized that there's way too much litigation and constraint and oversight in that world for me personally to be able to do well in it. So I had to pivot. And if I were so gridlocked on that, I would have missed the opportunity at VHP because I would have thought that that population isn't conducive to where I'm going. I would have missed the opportunity to come down here to Dallas because I would have been pulled to whichever city was going to be able to hire me or willing to hire me. You know, but then at the same time, I've continued to kind of keep my goal, and that's, you know, kind of what has formed this athlete restoration project, where now we are working with the pro athletes, we are working with, you know, high level individuals, and we're doing so on a you know, on our time and with our methodology and approach, and we're doing it in this fascial based approach, you know, a neuromuscular approach that we feel is significantly more effective for specifically pain and injury restoration. So for that young population, you know, definitely just don't dismiss anything. Had you asked me at 25 what I thought about fascia, I would have told you it's BS, a phantom thing, you know. So just really stay perceptive to that, and really try to find yourself in difficult problems that you're forced to solve, because that will ultimately be the best teacher.
Completely agree. Completely agree. And Dan, for people who want to find out more about you and check you out online, where can they find you at?
Yeah, so I have all the stuff now, Instagram, Twitter, YouTube. So on Instagram, my personal handle is at danmode_rude_rock. It's the same on Twitter, I believe, and then our team page is at Bachik Methods, BACHIK Methods. There's a ton of great coaches and trainers there doing amazing things. And then Rude Rock Strength is our other Instagram handle. And then our website is just ruderockstrength.com. And we have a lot of content through Simply Faster, so there's a good reflection there as well.
Yeah, and I think you've got like a Con Ed course and different things there as well too, correct?
Yeah, that's our Fascia Chronicles course, which came together beautifully. A lot of information in there. So if this conversation caught your interest at all, you'll definitely find some value in there. And I'll throw a little discount code together for any listeners on here. You can put that in the show notes.
Awesome. We appreciate that. Dan, thank you again for your time, man. This was awesome.
Absolutely, brother. Appreciate you having me.
Thank you so much for listening to this episode of the Brawn Body Health and Fitness Podcast. If you liked this episode, please make sure to share it with a friend, subscribe so you don't miss any of our upcoming episodes, and leave a review. This way we can spread knowledge and motivation and help reach more people. Thank you again for listening, and I'll see you next time.